I have checked my chart and gathered all of my equipment, and I've verified that I'm the right order to perform insertion of a catheter and NG tube and removing and getting samples as well. So, hi, my name is America. I'm your nurse today. Wash my hands. Can you please verify your name and date of birth? Okay. Just gonna check your wristband, make sure. Okay. So, have you, do you have any allergies? None. Are you in any pain today? From 0 being none and 10 being excruciating pain? None? Okay. So today what we're gonna do is we're gonna insert an NG tube and a catheter, and we will be removing them later, and I will be obtaining samples for both as well. Now I'm going to take your vital signs. Okay, I'll make sure to document that. Now I'm going to wash my hands, put on some gloves, and then throughout this procedure, let me know if you have any questions. Okay. First thing I'm going to do is inspect your nares, make sure they're not irritated. And then, have you had any surgeries or had an NG before? No? Okay. All right. What I'm going to do is now I'm going to measure to make sure to know how much to insert from your earlobe to your nose, to your xiphoid process. Okay, I'll make sure to take this to make sure, and then I have that taped. All right. So here's this cup of water. I will have you sip the cup or sip some water while I'm inserting your NG tube. I will have you tilt your head up. So now I'm going to lubricate. Okay. All right. So I'm gonna insert it now. Let me know if you want to stop at any point. Make sure to keep sipping your water. Okay. Now I'm going to check if I can see the tube. Okay. All right, now I can have you tilt your head back down. Okay, now I will attach the tube to your gown. And now I will obtain a pH sample. All right, I'll attach this back on there. Make sure the vent is above. I'm going to test pH and see if it's within the normal ranges. Okay, it is. Now, I will send you to get a chest x-ray to make sure that we have placed the tube correctly. Okay, came back. The placement of the tube is correct, so now we're just going to proceed to attach to the NG suctioning device. So I would have to remove these gloves, wash my hands, put on a new pair of gloves, and so now I'm going to get my adapter. Oh, sorry, I have these backwards. Okay. I will open the valve, attach it to your gown once again, and I will. There's a tissue if you'd like one. I'm just getting ready. I will now put some barrier cream and attach some tape to secure the device or to secure the tubing in place. So now I will remove these gloves, wash my hands, put on a new pair of gloves, and perform oral and nasal care as well. Before anything else, before I leave the room, I'll make sure to turn on my suction device to the appropriate order to set it on. So now I'm going to do this. Throw away my gloves, wash my hands. So, yeah, this is attached to your gown. That is all for this part of this procedure. Now we're going to move on to inserting your catheter. All right. I'm just going to lower your head and position you in a recumbent position. Okay. I'm going to wash my hands and my gloves. I will be exposing you for this procedure. And as I mentioned, I will be positioning you in a recumbent position. Okay. So now I'm going to perform peri-care. Take off these gloves, wash my hands, and I will have to take them off now. Begin. Cartridge. All right. My gloves. Got my secondary nurse. Left. Okay. All right. Now I will, with my non-dominant hand, I'm gonna get my loop ready to go before I start. That would not have happened. A lot of force. Okay. All right, now with my non-dominant hand, I will get my swab sticks, my iodine, with each stick. So one, throw away, down the middle, and garbage. Okay. So this is still sterile, and this is not sterile now. So I'll get this out of the way now. And then I will begin now, so take a deep breath and let me know if you are wanting to stop, if you feel any excruciating discomfort. Okay, I see urine coming out, so I'm gonna just insert 2 more inches. Okay. All right, and then now I'm going to inflate my balloon with 5 mils of sterile water. Okay. That would not have happened in the real world. Okay, I'm gonna finish inserting it. Okay. I will tug on it, make sure. Okay. It is in there now. Now I will just clean up a little bit. Or no, I'm gonna secure, oh, let's see it. Let's secure my device. Okay. I'm sure to put this in the bladder. Alrighty, now I will remove these gloves, wash my hands, and I'm just gonna get a new pair of gloves. I'm going to now clamp. Okay. And I will have this clamped for 15 to 30 minutes. Now that it's been clamped for that time, I will get my urine sample. Clean the port. Okay. And I will get around 7, 8 mils of urine sample. Make sure not to soil the edges. Make sure it doesn't splash everywhere. Okay. Without touching the inside of the cap. I will send this to the lab. I will put the name, date, time, and remember, and send it out to the lab. Okay, now I'm just gonna take these gloves off, wash my hands, put on another pair of gloves, and do pericure. And now, after I've done pericure, I'm gonna clean up. Make sure to unclamp this. And take these gloves off, wash my hands. Put her back in a comfortable position. Gonna cover you up for privacy. So now I'm gonna go gather my equipment. Here's your call light. I'm gonna gather my equipment to remove yeah, I'm gonna go gather my equipment. Okay, I am back now. We are going to be removing your NG tube and your catheter as well. So I'm gonna just wash my hands, sit you up. Off your suction device. I'm now going to wash my hands and put on gloves. Going to unclamp this from your gown. Remove the tape. Garbage. Since I turned that off, I will close the valve now and tell the chin. Stop. Okay. Alright. So here's a basin if you have the need of throwing up or feeling nauseous. So now I'm going to clamp this, and oh, I need to put a towel on you. I don't want to make a mess. Here you go. There you go. Okay. I want you to take a deep breath and then hold your breath while removing this. And let me know if you feel any discomfort or do you want to stop at any point. And then I'll make sure this is intact, still intact, and it is. Okay. I'll dispose of this in the appropriate receptacle. I will now perform oral and nasal care as well. Okay. I will remove my gloves. Wash my hands. And before anything else, before I move on to removing your catheter, I will make sure to measure the output, and I will document that. Okay. Now we're going to move on to removing your catheter. Okay, and once again, I'm going to have to expose you for this part, and I will have you in a recumbent position once more. I will wash my hands, put on gloves, perform peri-care. I'll put your head down. It's going to be more comfortable. But I have done peri-care, remove those gloves, wash my hands. Now I will wash my hands and put on a new pair of gloves. It's ready. All right, can I have you lift your hips up? Okay. All right. So now I'm going to drain the bag, and I will measure and document how much output there was. Okay. I'm gonna also take off this securement device. Gonna now deflate the balloon. Make sure to remove the 5 mils that I put in there. Okay, once I have deflated the balloon, now I'm going to remove the catheter. So take a deep breath. Let me know if you want to stop. I'll make sure to throw this away in the appropriate receptacle. And then I will remove these gloves, wash my hands, put on another pair of gloves, and perform peri-care once more. I'll remove these gloves, wash my hands, have you in a comfortable position, cover you up. Here's your call light. Let me know if there's anything else that you need. I will now go document my findings. And that is all. We're complete.